Well, good afternoon. Here's the last COVID update for it. So unless something drastic happens, this will be about it. So can somebody just message on Facebook, please, to make sure the audio sounds okay? We've had issues, and the last one was a disaster with our audio. So if it's all distorted and stuff, just let us know. But if it's nice and clean, then fantastic. But made some adjustments. So number one, I'm going to go through, kind of where we're at with healthcare facilities and long-term care facilities and the community as general. And then I'm going to go through more detail of the town of High River's actual relaunch strategy of getting things up and going. So number one, as usual, massive thank you to all of our frontline workers, the whole community, the residents, the businesses. What I'm seeing going on in High River now is night and day from when this thing started, and it shows you the lessons that we've learned. It shows you how we've adjusted things so that we don't see a second big wave. Yes, there's going to be cases come and go and stuff, but we don't want another great big wave. And when I see what's going on with the use of masks with businesses, et cetera, these are all the little things on a day-to-day basis that are going to keep this thing under control in town. And, overall, what we were looking at two and a half months ago was not looking very good. And we were all, pretty concerned as to where we were headed with it. But going through things and learning and adjusting pieces, overall, we were very, very successful in coming out of this massive outbreak that we had in High River. So huge kudos to a number of people that I'll go through in just a minute. But I want to stress that, yes, we came through it overall successfully. I don't want it to diminish the fact that there were 7 lives lost in the High River zone, and 5 of them were just on our local High River Hospital second floor long-term care. The other 2 being residents. But it's hard to call it a success when we did lose lives. It's hard to call it a success when there was a number of cases, 540 some cases, and the anxiety and the stress that those patients and those recovering and those family members all went through, going through this, especially if you had a loved one in a long-term care facility that was on lockdown or still is. It's not easy. The stress and anxiety and that's on those people dealing with that, and the family members not being able to see them, and all the social distancing. It's been a ton for everybody to get through this. But from what we were looking at the start to where we've come out with it, we were successful in curtailing a massive issue. So that all came to play because of a number of people that stepped up right away. And I'll go back to my first phone call from Dr. Adam Weiss that really triggered. I was getting concerned and trying to figure out which way to go. And that Monday morning when he called and we started to put a plan together, and Dr. Chris Warner, the chief of staff at the PCN, he got involved, and we were all talking, and all the PCN putting a plan together, and then, the big cannonball that we did with the government to get their attention down here. And can't thank Dr. Henshaw enough for taking notice, and Dr. Hugh that was put on the ground directly in High River to get everything in place. Premier Kenny phoning me directly to discuss, reopening. Those are the kinds of things that are critical. This communication, the direct stuff, which is, frustrating at the start, but we got it going, and it was very, very successful going through it. And our MLA, Roger Reed, was, texting me and phoning me. What else do we need? Where are we at? All those pieces had to come in play properly, but the majority of it was done locally. And then most of it was done with our local doctors, our residents, the staff at the High River Hospital. You know, everybody stepped up and took it seriously, and we went for it and came out of it as good as we could. We were successful with this, but the PCN network, our primary care network, which is all our doctors and everybody being involved and working directly with Alberta Health Services and working directly with Ministry of Health, what I'm told is that never happens. So it shows you what can happen if they're all working and we're all talking together. So very, very well done by everybody, and I'll continue to say the thank yous out there. And another group that did one heck of a job is the High River Healthcare Foundation with Kathy, Rhonda, and Michael. The different things that they were putting together and taking care of the staff over there and blah, 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 could go on and on and on. It was absolutely phenomenal what everybody did. So thank you. We came out of this. We're down to 3 cases in High River. We're looking good. There are 0 cases on second floor right now. There's 0 cases at Seasons. There's 0 cases at Medicine Tree Manor. So we're doing well, and we got to keep it that way. So that's what I want to talk about, is how we're going to do that. So a little bit back to the hospital. Those of you that are interested as to what's going on at the hospital, the maternity has been brought from Calgary back to High River, so maternity is up and running back at the hospital as of yesterday, I guess. Surgeries, the day surgery units, they're back at full capacity, so everything's looking good there. Now for the actual relaunch within the town, you know, I'll speak about playgrounds, but as this stuff opens up and businesses start to reopen, we have to remember that this does not mean that COVID's gone and it was all just a conspiracy and never really happened, which is BS, but we still have to be careful. And we've learned our lessons, and we know how to conduct ourselves and stay safe and keep our friends and neighbors safe, so we can't lose sight of that, even though some of the things are getting relaxed. So one of the big things is that keeps getting talked about is that if you feel as though you have symptoms, we need you to get tested, we need to trace your whereabouts, and we need to get you isolated. That's how we get this thing to stay within the 3 cases, right? That's how it gets done. So it's very, very important that we don't lose sight as we open up that the virus is still here, and we can still have outbreaks. You hear what happened up in Edmonton, where one, large family gathering took place, and a number of those family members get sick. So be very, very careful still. So going to the whole relaunch strategy. Now, Michelle and Donna with our communications department have put out the actual Town of High River relaunch strategy. That literature is out there. It's on Facebook now, is it? Yeah. It's posted on Facebook, so scroll around from where you're watching right now and you'll find it. But so number 1, we're still at stage 1 with the provincial relaunch. Stage 2 timeline has not been announced yet, and I know the dates are flying all over the place up there. So reflecting on what the town's relaunch is. So June 1st, playgrounds and playground washrooms, so George Lane Park and Birchwood, those washrooms and playgrounds are being reopened. There are some areas where inspections are taking place and they might be closed down for a day or so if there's some repairs that need to be done because they still need to be safe. But physical distancing, those kinds of things still need to have attention paid to them. And using hand sanitizer when you're there. So yes, it's low risk, but it's not zero risk. So if you're going there, it's your decision. We respect that people are allowed to make their own decisions for themselves and their families. But still the note to be careful around these. Sports fields, tennis courts, pickleball courts, they were all open on June 1st. The skate park, horseshoe pits, George Lane, yard and garage sales are permitted. That's another one where those of you that are holding these events, these garage sales and stuff, you got to have some boundaries in place with this. And if you get too many people and they're all huddled around your $4 used table, you got to keep people space. So you'll deal with it though. Mobile vending and food trucks, those are all open June 1st. Happy Trails dog parks, they've never been closed. Shepherd Family Park community gardens are open. Gardeners are responsible, again, manage at all of our community gardens to, continue the safe distancing, etc. So opening June 15th, George Lane Park will be open. George Lane Campground will be open at 50% capacity, so every second stall. And that we're going to watch and, might be adjusted, might stay the same as we go along. But first off, we're going to open it up to 50% capacity. The farmers market, our town staff, council members are involved with talking with the organizers of the farmers market as to when that might open up and where. So that's still up in the air right now as to what those dates look like. So July 1st to August 31st, this is where kind of the town operations and getting staff back to work. Those that have been working remotely, those that have been laid off, they're all starting to come back. But it'll take a while to get that and kind of preparing for the actual provincial full open of stage 3, which will be who knows when, but we're paying attention to what's going on with what Edmonton's doing as well. So that's a reprint of the previous thing. So that's really about it. The relaunch will be adjusted as we go along. As I've said all the time, like this is still, it's under discussion with council constantly, and it can change on a daily basis, such as the playgrounds did. So we'll keep going. If you have questions, get a hold of either myself or one of the other councillors, and we'll try to get your questions answered and see where your concerns are, and we'll continue to grind this out. But at the end of the day, from where we started to where we are today, very, very well done. And our condolences to those that were affected by it. There's no question that our hearts go out to those families. So, but from there, we're looking good, High River. So very well done. Questions?
Yes, regular business question, regular town business, I should say. Wondering if you can provide an update on the river.
On the river, yeah. So COVID's gone. Back to the river. The river's just fine. It's flowing at about, well, I can tell you in 7 seconds, but the river is flowing at low levels right now. I think it's probably around 70 CMS, which isn't even on the radar of a concern. So, we continue to monitor it. Yeah. 80 CMS is what the river's currently flowing at. Not even a concern, but yeah, there's rain coming this weekend and that, but it doesn't look like it's anything that's of a massive concern. Everything, all the emergency measures are in place. The southwest berm is flying. If you haven't been by it, you got to go see the amount of earth that's moving over there. So yeah, continue on. Things are looking good on the river.
Somebody's asking if you know when senior centers will be allowed to reopen.
Senior centers.
Senior centers.
So senior centers being like Friendship Center and those kinds of things, or like public access to Medicine Tree Manor. All of those pieces, senior centers, whether it's Medicine Tree Manor or the Friendship Center, those decisions are made by those people. Those decisions are not made by the town of High River. So you'd have to ask them on specific venues like that are outside of the town of High River boundaries. All good?
That's all that's coming.
Still drinking coffee today. Been a long day. Well done, High River.
Thank you.
Take care.